Hi, this is Dr. Richika. So let us enumerate some points so that how you're going to choose the best IVF center. This is for all the people who are listening and seeing this video so that you can just put it as a checklist to shortlist your IVF center. So first and foremost, what you have to do, you have to see whether that's a standalone IVF center or it is a multi-speciality IVF center. That means that it is catering to multi-speciality services. Because now are the days when females are getting married late, plus there are many medical disorders which are genetic in transposition, and patients have been having these as congenital disorders. Like nowadays you'll see many patients who are type 1 diabetic mellitus, because earlier what used to happen, these patients never used to survive and never used to come to the reproductive age group. But nowadays they too come up to the reproductive age group, and we have to do IVF in these kind of patients. So for that, basically a multi-speciality hospital is the best place to come to in patients who are having diabetes, who are having hypertension, who are having thyroid conditions. We need to have a multi-speciality approach so that we can have cross-reference for these patients. Cross-reference means like you are able to show patients in the same setup. In the same setup you have doctors, in fact you have super specialist doctors of other specialties who can cater to your problems. Secondly, every procedure, every medical procedure that is being done does carry some or the other risk. So if you are having any complications during the procedure, we can cater to it, because that patient can be shifted immediately to a ICU which the multi-speciality hospital is having. Multi-speciality hospital means any hospital who has got all the specialties, means all the departments of medicine. Thirdly, when you are getting this kind of procedure done in a standalone clinic, and if you are having any complications, then you will definitely be shifted to a multi-speciality hospital. But what will happen? You can lose the time in the transit, in the transport, because standalone clinics are those centers which are having only one specialty in it, and they don't have a multi-speciality, means other specialties are not there. And secondly, then you have to go for the infrastructure. You have to see whether the IVF lab is totally equipped, the embryology equipments have been in place, the consumables, what kind of consumables they are using, the injections, what kind of injections they are using, so that they are able to make good eggs or not, and whether the embryologist is fully trained or not. So coming to the infrastructure, you have like a proper backup should be there, plus the accreditation should be there, like NABH accreditation, ICMR accreditation, PCPNDT accreditations which India is giving. And in India it is legal to do IVF if you are accredited with ICMR, PCPNDT, and NABH norms are followed. NABH norms are like the standard norms that have to be followed by a hospital to give good care and good quality care to the patients. Then coming to the people who are working. So like basically the IVF has got two separate departments, what you can say. One is the clinical part that is being seen by the IVF specialist, the doctor. Second is the embryology lab. So every lab should have a dedicated full-time embryologist. Means the embryologist has to have a team in which the embryologist has to have a lab director who is a full-time experienced embryologist. Secondly, she or he should have people under them, junior embryologists, who are there round the clock to manage all the quality control of the lab. Coming to the clinical part means a doctor has to be there who is well dedicated and who is well qualified in doing all the IVF procedures, who should know how to manage all the complications and how to manage all the difficult cases of IVF as well. Because nowadays we have got different, it's not like a simple clear-cut case. We have patients with very low ovarian reserve, poor ovarian responders because patient already has got multiple stimulations. We have got patients with male factor infertility, with different kind of surgical problems in uterus or ovaries, with endometriosis, with PCOD. So the clinical director, the clinical head should be well aware of all this and should be able to deal with all this. So these are very important points, including the infrastructure, the place where the IVF center is, and plus all the people who are working there, they have to be very good. Thirdly, you need to have transparency in the system. So you should be well aware of such IVF centers who give you all details of the eggs, the oocytes being retrieved, your levels of hormones, the eggs retrieved, the embryos made, the pictures of the specific embryos. And patients come to us and say that how do we know that these are the pictures and this is the good embryo. So this is now is a century of awareness. People are very much aware, the media is very much active. So if you just log on to Google and all, you can check pictures of day 2 embryos, day 5 embryos. You can see how the oocyte looks, how the sperm looks, a good sperm, how does it look, and a bad sperm, how it looks. So we need to have videos of everything, and we need to share that with the patients, because after all they are part of the IVF program and it is their gametes and they need to know about it, everything. So these are some of the like specifications which I can only enumerate, so that you can just hunt for a good IVF center and get yourself properly treated, means cured, or you can, that can lead to your parenthood. So good wishes for your parenthood.